This home sleep testing device tests specifically for sleep apnea. We want to make sure that it's set up properly so that we can review the results. A sleep specialist will then be able to evaluate and possibly diagnose a sleep disorder if it's present. Home sleep testing is one of the ways that the sleep lab at St. Elizabeth's Medical Center is helping to diagnose patients with sleep apnea. This video will demonstrate the proper setup and use of the home sleep testing equipment. Proper setup of the device is important to ensure that the recording is adequate and it gives enough information for a doctor and a sleep specialist to be able to evaluate your sleep and make sure that there are no issues or diagnosed issues if they are present. When you receive your home sleep testing device, it'll come inside of a bag. Inside the bag, in the front pocket, you'll find a roll of tape. In the main part of the bag, you'll find the device and the equipment needed to set it up. You'll have a nasal cannula, and you'll have the device itself that also has a pulse oximeter attached to it. The device is set up with brand new batteries, and it's able to record over 12 hours of sleep. The first step in setting it up is to attach the device to your chest. Right in the center of the chest, like so, and you will bring this band around the chest, and you will attach it on the other side. There's one place for it to go, and you pull it all the way through, and then you will Velcro it back onto itself. It should be a snug fit, comfortable and not too tight, and completely painless. The device should not be sliding down, and it should not be flopping forward off the chest. If that is happening, then it's too loose and you need to tighten it just a little bit. The next step is to attach the nasal cannula. Open the bag that the nasal cannula comes in. You'll find that one end has a connector piece that goes to the only open connector on the device itself, and it goes in and around it, and it twists on into place. It doesn't take much. It's only about 2 twists, but just make sure it's secure. It'll tighten like a screw. The other end of the nasal cannula has 2 nasal prongs, and you'll place those inside the nose, and you'll put each tubing over your ears, and then in the front there is a slide, a little toggle that you can tighten. Once this is done, we want to make sure that the device stays on all night and doesn't slide out while you're moving in your sleep. So you can take a piece of tape and you can tape the tubing right to each of your cheeks. Like so. The next step is to follow the cable from the device that goes down to the pulse oximeter. You will place this onto one of your fingers. Make sure your finger is all the way in. And then again, you are going to use tape to secure this in place. So you can tape right at the base of the wire, on the finger or on the hand. I also suggest taping up the arm. So you may want to tape it to the forearm and possibly again up on the shoulder, but completely dependent on how comfortable you are. From there, you will probably still have excess slack, and to take up some of that slack, you want to slide the connector piece right onto the belt. So once everything is taped in place and attached, the only thing left to do is press the start button to start the device. There's a start-stop button. It is one button right in the center of the device. You'll hold that button down for a second or two until you see the indicator button light up green. and release your finger once you see that it lights up green. You will also notice that once you've done that, there will be a red light inside of the oximeter that will light up once it's started. This red light inside the oximeter will stay on for the entire night. As you can see, it turned red when I took my finger out of the oximeter. It'll return to green now that I place my finger back inside. Once you go to bed or once you lay in bed, this green light will dim after about 10 minutes. It may look yellowish or light green in color, but it's just a battery-saving mechanism, so don't worry about it. As long as it's green, the device is working properly and recording. So once this is set up on you, you are then able to get in bed. You should lay in whatever position is comfortable for you. That can be the back, side, stomach. We like to say do what is normal for you as best as possible. It's not going to be the best night's sleep you've ever had wearing all of this equipment, but do your best. Don't stress about anything. If anything bothers you during the night, if, for example, the finger piece bothers you, you can always pull it off and switch it to a different finger. That's not a problem. So once you've started the device, leave it running for the entire night. Even if you get up to go to the bathroom, even if you're wide awake laying in bed, just let it run for the full length of start to stop from when you go to bed to when you wake up in the morning and you're actually going to get up out of bed for the day. You want to leave yourself a minimum of 6 hours to record. So plan your sleep-wake schedule accordingly. So when it's time to awaken for the day and you're ready to shut off the device, you're going to press that same start-stop button in until that green light turns off. And the device has now stopped recording. You can detach the device from yourself and get up and go on with your day. The nasal piece that you attach to the device, you will take that off and detach it from the device, and you will throw that in the trash because it can be discarded and it cannot be reused. The rest of the device can be reused and cleaned, so you will detach that from yourself. And you will return it to the bag that it came in and bring it back to the sleep lab the following day so that a sleep specialist can download all of the information and evaluate your sleep in order to determine whether you have a problem with sleeping or not. If this video did not answer any questions that you may still have, please refer back to your patient packet and find the number of the sleep lab, and you can call, and there should be a tech on call to answer any further questions for you.